We're ready. Go.
Okay, today we have a patient and we want to go and use of the high-tech technology for gait scanning. The name is Atrix, and also is going to be help us to evaluate the patient's problem, especially for the feet problems. If the gait is not normal as a pes cavus or pes planus, we can consider patients sometimes that has a metatarsal pain or they do have a bunion pain. We can consider all the problem and teach the patient about the problem and order the depend of the gait analysis. We can send them the lab for custom-made orthotics. Today we have a patient and then we're going to be asked the patient to come and stand up. We can consider patient as a female that's going to be go as a
Please
female
stand on
patient.
scanner with your hands comfortably by your side.
Okay, Mina, could you please come? Yeah, come middle of the screen, a little bit open your, yeah, perfect. And then we are going to scan it.
Capturing length, capturing width, capturing instep height, capturing arch height, capturing girth, initiating pressure test. Prepare to walk across the scanner
Mira,
in
could
your
you please
natural
come
stride.
stand up here and
With
take
your
a
left
look
foot
the back?
first, step on the scanner as you continue to walk to the other side. Then turn around and repeat the process, leading with your right foot.
Just normal walking, you have to walk in the scanner, okay? You ready? First you go with the left
Okay.
and the middle. Yeah, put it the left and the middle and the right all of the screen. Just normal walking, perfect. And turn back, first started with the right, in the middle and perfect. And you can have a seat there. I'm gonna be go and check your gait. Okay, if take a look for the pressure, when the patient is standing, most of the pressure is on the heel. It could be shows up on the heel on the pressure. That's why you're feeling pain, especially in the morning, you're feeling pain in the heel. The orthotics, it should be ordered, should be considered accommodation, some heel cushioning for you. If you take a look left and right, there is a lot curve here. That means you are pes cavus and you have a bunion. And you have a pressure also this part as a bunion, and the practitioners should be consider your bunion in this area. If we go and check for the 3D measure your feet, you can take a look your feet here and you can check with the measuring of your feet. The feet size is going to be shows up 8.5 US. How about sometimes patient with the bunion, we recommended to have more room in the toe box to use of the half size bigger, because you want to put it specifically orthotics, and orthotics is a little bit bulky for you. And then if we check specifically for your tibia and also for your ankle, this machine can help us and check if you have some deformation specifically on this navicular bone. Take a look like that one. It should be straight, but it's not straight. That's a kind of problem. And then that means the midfoot is going to be pushed to overpronation for you. And if we are going to gait analysis, when you're walking, the patient is walking, that's the gait is going to be pressure to shows up with machine which part of the feet you have more pressure. If take a look, that's your pressure area, especially left side that you have lots of pressure in this area. And sometimes maybe you have a calluses in this area. You have a bunion, you are pes cavus, you have a problem on the bunion area and you have a problem on the heel. That means you need definitely to use of the orthotics, otherwise you find a problem later. We are going to the learning center and ask the patient for
Welcome
the
to my learning
problems.
center. Based on your foot profile, here are some topics I believe may interest you. But feel free to ask me anything.
Okay. As we explained, patient that has a plantar fasciitis is
The
going to be
plantar
shown.
fascia is a band of tissue connecting your heel to your forefoot. plantar fasciitis is a painful swelling of this tissue caused by excessive stretching of the plantar fascia. By appropriately supporting your foot and offsetting areas of high pressure, Atrix orthotics can help relieve the pain associated with plantar fasciitis and can help prevent future cases.
Also, we mentioned patient that has a bunion 1 feet bigger than the other one, and we can train
A
the
bunion
patient
is a
for the
prominent
bunion.
bump on the inside of the foot around the big toe joint. Some of the symptoms include inflammation, swelling, soreness, or pain in the bunion area. The problem can develop from an abnormality in foot function, or arthritis, but is more commonly caused by wearing improper fitting footwear that is narrow or tight in the toe area. To alleviate the pain, I recommend wearing shoes that accommodate the deformity. Orthotics are also recommended to support the arch and reduce overpronation.
And also for the accurate of the assessment, we are going to make a cast of the patient. We already made a cast of the patient, and also the cast, we're going to be sending the high-tech gait analysis and scan it, and also about the casting altogether to the lab orthotics. Orthotics is going to be accommodated with the molding, with the cast, and make a proper orthotics for the patient. And definitely it's going to be helpful for the patients to feeling better after that.